All right, good afternoon. My name is Tim Como, and I'm the clinic manager of the Family Healthcare Center at STAR. I wanted to thank the mayor and the local elected officials for showing up today and joining with us. September is Recovery Month, and we wanted to take an opportunity to celebrate the fact that recovery is possible and there are effective evidence-based treatments for folks that are suffering from opioid addiction, and we want to talk more about that today. STAR provides integrated primary care, mental health, and substance abuse treatment. We have approximately 900 patients on methadone, 300 patients on Suboxone, and 100 patients on Vivitrol treatment, which is medication-assisted treatment. Dr. Bailey and Dr. Martelli will tell you more about the medication-assisted treatment options shortly. We also wanted to let the community know that we have recently opened our doors at the Health Center here at 1010 South Main Street at 6:30 in the morning on Wednesdays, and we've done that to accommodate our patients on methadone treatment because several of them are getting dosed early in the morning before they head out to their jobs. So by opening at 6:30 and offering primary care, folks are able to come in and get their methadone dosing as well as their primary care before normal business hours on their way to work. So we're pretty proud of that, and we look forward to continuing it. Our main hope today is to provide a basic overview of medication-assisted treatment and to encourage the community to view this treatment as they view other forms of treatment for chronic conditions. So this is another form of treatment for another chronic condition. You'll hear about the medication-assisted treatment options, and we just really view it as chronic condition treatment. It's my pleasure to introduce Nancy Paul, the CEO of STAR.
Thank you all for coming, and I'm very excited today because we're trying to get more information out about addictive disorders and what we can do at STAR to help. I do want to emphasize that what we have learned is that addiction really is a pediatric disease. You very rarely hear of anybody in their 40s becoming addicted to drugs, with a few minor exceptions. The process of the disease starts to occur when they're young, when they're in their early adolescence. We need to do things to prevent it. But once people do become addicted, we need to find effective treatments. I spoke this week at the Kraft Foundation to fellows that are in their fellowship program for community health. And I had a picture of my grandmother and her family, and this was in about 1904. And next to it, well, and the family, she was in a horse and buggy, and they looked like they were getting ready to go to church. I can remember sitting in her living room on Winter Street in Fall River when a man landed on the moon in 1969. And she said, I started life off in a horse and buggy, and I have lived to see a man on the moon. And I have been in this role for 40 years. And I do feel somewhat the same way, that in the beginning, we really knew nothing, and we were treating just based on caring, good principles. Now we have evidence-based treatments, and I'm very excited today that we get to share them with you. I'm also very excited to introduce the mayor of Fall River, who I have known for many, many years, and who, from a very early age, had an interest in preventing addiction. And so I am very proud to introduce what I feel is one of my own, Mayor Jason Correa.
That is all true. I definitely consider myself one of Nancy's own, that's for sure. So I got a couple things to talk about. I don't want to take too much time, so I'll make my comments as to the point as possible. But there are a few elected officials here that I want to recognize as well. We have State Representative Alan Sylvia, who's one of the best state representatives in the state of Massachusetts, does an awesome job around a lot of different things, from veteran services and addiction as well, preventive care as well. So thank you, Alan Sylvia, for being here. We have school committee man Joe Martins, a school committee member that really is fighting for children in our community and does a great job on the school committee with me. And I always appreciate his insight, which is usually very different than others. So it's important to have that as well. was positive, which is great. And we have Councilor Pamela LeBeau, City Councilor, who has really been instrumental in this effort, along with Mike, and we're talking Mike Agnew, been talking together to really coordinate some of these efforts around substance abuse prevention and making sure that the City Council is informed. Information is power, which is one of the things that Nancy talked about here, right? So we're talking about evidence-based, so important to this fight against this disease that we call addiction, and that's really important. And she's right. I mean, even from when I was younger, 13 to 14 to 15 to 16, working around substance abuse prevention, I've always looked at the prevention side more. I think that young people need healthy alternatives to drug abuse in our community. I've even seen a change in the short amount of time that I've been involved, so I can imagine what we've seen over the last 40 years. And that was a really interesting analogy of the buggy to the man on the moon. That's really incredible. That's a huge span of time, and technology is constantly evolving, and human beings are constantly achieving new things. And I think that we can achieve some serious success, and I think that's what's going to be shared today from our doctors. Some of the success of this program in preventing and treating with this medication, which is really important. So today's message it's got to get out to the bigger community, and we'll make sure that we do that about the treatment that STAR is providing. STAR is leading the way, I think, nationwide, maybe even internationally, on these efforts. That's really commendable, and is another asset to our community. So whatever we can do at the Mayor's office, and I'm sure the City Council as well, to provide support to STAR, we are there to do. But really, the important thing that I want to talk about is, and Nancy said it, it is important to start with the prevention piece. You cannot lose sight of that. I think it's still so important. Getting into our middle schools, maybe even earlier, elementary school level, educating parents, educating students about substance abuse prevention, I think is still extremely important. And I would like to see the school committee and our state delegation help us with that, with funding for our schools in terms of preventative education around substance abuse. But we know that it is a disease. We know that diseases can affect people very differently. And once someone is addicted to substance abuse or substances, then we need to help them as much as we possibly can with treatment. And that's why programs like the ones we're talking about today are so important. And that stigma, breaking that stigma down, is very important. And that's something that I'm a huge supporter of, breaking down the stigma around the treatment of this disease. It is a disease. I think, at least in my time, and I mean, I say this very seriously, when I was in high school to now, the stigma around substance abuse has changed dramatically. And I hear it all the time from the conferences I attend. I happen to serve on the U.S. Conference of Mayors Subcommittee on Substance Abuse. The chairman of that committee is Mayor of Boston, Marty Walsh. I can tell you Massachusetts leads the way. Every state is dealing with this problem. Every single state, every single city. This disease is affecting a lot of families. However, I can tell you Massachusetts leads the way, and it's because of people like Nancy Paul, and it's because of places like STAR, and that's why we're leading the way nationally. But absolutely breaking that stigma is one of our top priorities, making sure that funding is available to expand these services, making sure that everybody can get treatment, which is something that we really have to work on with our beds and our bed situation in Massachusetts, making sure that people have access to treatment when they need treatment most. That is really important to me, important to our city. So that's what I want to conclude on. We're going to continue to help promote that message, and we will fight and be there for our great organizations like STAR. Nancy, a personal thank you to everything we do. I consider you one of the best leaders in the city of Fall River, somebody who I admire and has done a tremendous job in her career. We also have State Representative Carol Fiola, who just walked in, and I forget which office you're from.
Congressman Keating.
Congressman Keating, okay, I thought so. We have a representative from Congressman Keating's office. Congressman Keating has been leading this fight for a long time, both with his experience as a former district attorney and now as a congressman. So thank you for being here. So I'll turn it over. Am I introducing somebody?
I'll introduce
All right.
you.
Excellent. Thank you. Thank you all for being here. Please get the message out. We'll do what we can on the city side as well. Thank you.
I'd like to introduce Dr. Jeannie Bailey. Dr. Bailey is the director of our inpatient dual diagnosis unit, as well as the director of the research, many different research projects we have going at STAR. She's going to talk about Suboxone and Vivitrol treatment.
Good afternoon. Thanks for being here. Thank you, Mayor, for those wonderful comments and the other honored elected officials. officials that we have here, as well as friendly faces that I see in the room. So it's nice to talk to people that sort of understand what we're going through, as well as introduce some concepts to some new people. So thanks for coming, and thanks for caring. Thanks for caring about our patients, for taking the time to come here. And I've been asked to give you a 5-minute summary of the disease of addiction, as well as introduce some concepts about the medications that we use to treat it. So we're going to do our best to see what that's about, but I think you just heard me say the disease of addiction. And I do think that that's important for you to step back and think about, because we are now using that language to discuss a disease that is chronic and relapsing, that is not a moral failure, does not represent character weakness, and is actually probably an established disease state. Now we know that there's genetics, and there's environment, and there's your family, and lots of other risk factors that go into determining who might become addicted if they get exposed to an opiate, or to alcohol, or to marijuana, or whatever. But we also know that there's a lot of choice early on, but once a disease gets established, we don't believe it's really the disease of choice that we used to. Back in the good old days when you're talking about treatment with kindness, we basically thought we had to let people hit rock bottom. They had to make their own choice about pulling themselves up. There was nothing we could do. And so we just sort of had a very hands-off and punitive stance towards our patients. I think none of us think that's true anymore. None of us want to have people hit rock bottom. And truly, with the high potency opiates that are on the street, people don't live to hit rock bottom. And I dare say there's not anybody in this room who hasn't lost a patient or a friend or a family member in this last 2 years. So it is a disease, and it is a disease that we can treat, and we need to sort of use our evidence-based knowledge and the gaining of knowledge that we have to try to reach out to people before they hit rock bottom, and to try to talk a little bit about how it is a disease that we can treat. So if you look at the national data on hypertension and diabetes and addiction, and we don't have a PowerPoint, which I usually have up here with me, you'd see that the columns for relapse look exactly the same. The same number of people relapse from diabetes, relapse into hypertension, as they relapse into addiction. These are diseases that require some choice. You have to choose to take your lisinopril, you have to choose to watch your diet, you have to choose to take your exercise. They're all very complicated interplays between behavior, quote unquote, choice, and physiology. And what we know now is that once the brain gets addicted to a substance, that it's changed, and that the individual doesn't have the same opportunity to think the way he or she used to think, to focus and concentrate the way he or she used to think, and they make bad choices. I often say that the difference between hypertension and diabetes here is that when somebody eats an extra piece of chocolate cake and their blood sugar hits 500, nobody worries about that. It's a bad choice. Their body's not doing well, but the police don't get involved, families don't feel robbed. My patients, when they make bad choices, they're really bad choices. And that causes society to look at them and say, oh, maybe this person is an addict, or maybe this person is a bad person, or maybe this person now is a criminal. So we have to sort of step back a bit and say, yes, they made bad choices. Yes, there has to be consequences for some of those choices. But also we have to understand that in the throes of active addiction, people are not operating with the same set of brain cell activity that they had prior to becoming addicted. And therefore, in order to treat it, we have to treat it in lots of different ways. We have to work together with behavioral therapy. We have to work together with families to try to help them. We have to work with police to try to understand how to best, in our legal system, how to best set up deterrence and consequences. And we have to work with the individual around taking better care of him or herself. And that often, in this day and time, means taking a medication in addition to just going to meetings and going to counseling sessions and participating in the recovery. Recovery is a big word. We throw it around a lot. We tell people they ought to get engaged in it, that they won't get better until they do. But recovery is a composite of the person, rebuilding his or her life, usually with the assistance of someone from the outside. These are terrible diseases and they kill people. And it's really sort of quite compelling that if you look at heroin overdose in the people between ages of 18 and 25, it has doubled in the last decade. Since 2000 alone, the opiate deaths have surged by 200%. We know that fatal overdoses reached its all-time high last year in 2014, and every day in America we lose 80 people from opiate overdoses. Every day we lose 80 people. So these are not only complex diseases, but they're fatal diseases. And using a medication helps me keep somebody alive long enough so that I can try to talk to them and talk to their brain and give them some time to recover and rebuild the life structures that they need in order to move on. Now we have, at this point, the FDA has approved 3 medications for the treatment of opioids, and we're just focusing on opiate addiction today. Those medications are methadone, and Dr. Martelli is going to talk to you about that. It's been around the longest. That is buprenorphine or Suboxone. People call it Suboxone because it came on the market in 2002 and it held the market. The company that made Suboxone owned all of the rights for all of the medication until 2013. So it's become synonymous with the treatment. The medication is buprenorphine, Suboxone's one form. We now have in 2014 and 13 we got Zubsolv, now we have Univail. Words you don't need to worry about. The message is that more and more small drug companies are trying to come up with other alternatives so our patients won't just have 2 choices, that they'll have other delivery systems. Last year we got the approval for implantable buprenorphine so that it's in the person's body for 6 months. You don't have to actively get up every day and choose to take it. We're doing research on injectable forms of the medication where you take a shot once a week or once every 30 days so you wouldn't have to get up every day and decide to do it or not do it. We're trying to make these medications available to people in different delivery forms and with the intention that we help them calm the addictive brain down, the cravings go away when used correctly, the compulsive use to go get more, to have it, to have a higher dose, so that every day when they wake up, they don't have to think, where am I going to go next to get my next injection? They can think, okay, it's time for me to get the kids off to school. What time is the bus coming? Oh, I need to get to work. Oh, I need to go down and fill out those forms that I have to have so that I can get on my health insurance. Those are thoughts that never enter your mind when you're addicted, and every hour of your day is around, where am I going to get my next dose? So using these medications give people a chance to get back in charge of their brain, back in charge of their lives, and to make good choices which help them to rebuild their lives, not only in the world of not being a criminal, but also in the world of interpersonal sphere and in the sphere of employment. And we see people rebuilding their lives on buprenorphine throughout all of our treatment when used correctly. Now, the other medication that I want to just talk to briefly, and the other thing I want to say about buprenorphine is that you need to understand that buprenorphine is also an opiate. It's not the same as heroin, it's not the same as morphine, it's not as potent. It sort of is what we call a partial opiate binder, which means that it has this effect of some of the opiate properties, but not all of them, so you usually cannot overdose on it. But if you stop it, you will go into withdrawal. And when you get ready to come off of it, you need to be tapered off in a sort of a structured way with your healthcare provider. The next medication we have that we use for opiate addiction is called Vivitrol, or excuse me, naltrexone is really the medication, and you can take it by mouth, but nobody ever does. They fail at that. So it was developed in an injectable form that you take once a month. That is called an opiate blocker. If you have that in your system, it blocks any effect of any opiate that you take. So one sort of satisfies the need on the receptor without keeping you engrossed in an addictive cycle. The other one blocks the receptor. And both of these have strong evidence that with these medications, people are much more likely to be able to stay off of illicit drugs, to not participate in high-risk IV, Hep C injection activities, and to be able to rekindle and join society in a productive way. We know that people relapse. We know these are chronic illnesses, but all of the data shows that staying on the medication and being in treatment with for some kind of behavioral component where you really practice and learn new skills is the only way that we can really sort of overcome this. So we have one more medication, which is methadone, and Dr. Martelli is our medical director here. We're very glad to have him on board as a STAR employee, and he's the medical director that helps dispense our methadone to our clinic here at 1010 South Main.
For those of you who don't know me, I'm Dr. Peter Martelli. I've been practicing in Fall River just shy of about 30 years now, and I've been taking care of mostly women with addiction problems for that time. I was an obstetrician gynecologist for many years. Now I'm a recovering hospital administrator. That's why I'm here. But you know, I left OBGYN practice, went into administration, and then wanted to get back into patient care. And Nancy offered me the opportunity to come and be the medical director at Lifeline, which is our methadone branch of our recovery program, our addiction treatment program. It's been a privilege to be here. I really enjoy it. Like Dr. Bailey's given you pretty much an overlay of what we do. We just use a different medication. And methadone is also an opiate. It works a little bit differently than buprenorphine or naltrexone, but it essentially does a similar job in occupying the same areas that a morphine type derivative would, and allows patients to function in many jobs, or pretty much any job they want, except long distance truck driving, while they're on therapy. It allows them to become productive members of society again, to have some self-respect and some dignity, and to contribute to the overall welfare of the rest of us, to stay away from crime, to stay away from behaviors that spread communicable diseases. So it's a good medication. It's a good program. We got here, it's really interesting to see, one of the things Dr. Bailey alluded to was the explosion of this problem since about the year 2000. And if you read about it, largely is the reason for this is that in about 1997, 1998, a medication was introduced to the medical community called OxyContin. And we were all told by our pharmaceutical reps that OxyContin was not addicting. This is a miracle pain drug because you couldn't get addicted to it. And the reason you couldn't get addicted to it was because it was a slow absorption over many, many hours. So when I had the rep in my office, I looked at the package insert, and on the insert it said, "Do not crush, inhale, or inject." And I said, "Well, if it's not addicting, why is this on your package insert?" He said, "Well, they put that on all." I said, "Well, what's the reason they put it on all?" And he said, "But don't worry about this." Luckily, my post-op patients didn't like it, and so I gave up prescribing it. But it was really the med that changed the world in terms of addiction. And of course, it's expensive. And what the natural progression is to start on Percocets or oxycodone type preparations, to move to OxyContin, and then because it's expensive on the street, to move to heroin, which is much, much cheaper and very easily obtainable. Part of the problem with illicit drugs is, with heroin in particular, is that unlike oxycodone and Percocet, these aren't made in a pharmaceutical company by pharmacists. These are made by who knows, in wherever. And what's in these bags of heroin is very unpredictable. We now even have artificial counterfeit pills that look like regular medication that have fentanyl and other adulterating substances in them. So it's becoming a much more dangerous world out there for people with this problem. So it's imperative that we use whatever tools we have to combat this problem. And as also as Dr. Bailey mentioned, methadone, as I tell my patients, first of all, in this clinic, you're not an addict. You're a patient with an addiction problem. When you go to the doctor with pneumonia, you're not a lung. You're a patient with a breathing problem. And your doctor doesn't get mad at you because you got pneumonia. It doesn't blame you because you're less of a person because you're coughing and you've got this problem with your lungs. So we don't do that here either. You know, this is a medical problem, this is another disease, we treat it as such, and you're a patient with an addiction problem. I also stress to our patients that, you know, methadone is a tool, and it's one of the many tools that you need in recovery. So if recovery is this big, methadone, Suboxone, naltrexone are all over in the corner over here. And what they're there for is to provide someone with a timeout. So now you have a timeout for having to worry about finding your connection and going out and spending all your money on something that's harmful to yourself. And you can now spend your time, your energy, your money building your social connections and getting your life back, getting a job and becoming a productive member of society. So that's the work that we do here. Fortunately, we have a very comprehensive program. We were able to use our highly skilled behavioral health specialists to assist us in helping our patients' recovery. It's a great organization. I've been involved with STAR for almost since I started practicing Fall River in one way or another. So I'm very proud to be here, and I'm very happy to be here. So if anybody has any questions after, I'd be happy to answer them. I'm sure Dr. Dooley will too, and thank you very much for your time.
Thank you, Dr. I'd like to introduce Lorraine Arsenal St. Pierre. She is the Program Director of our Medication-Assisted Treatment Program at STAR.
Good afternoon. It really is nice to see a lot of familiar faces out here. I've been working at STAR since 2004. I've been a case manager and I'm the director of this program. We've had a lot of admissions over the years, and it's a very exciting time actually to be working in the world of recovery because there's so many treatment options that are out there. So today's big idea and push is that we really try to help destigmatize patients coming in for treatment. So oftentimes when I'm in the community, either at a fundraiser or out with friends, people ask, you know, what do you do for work? And I say, I work at STAR. Well, I usually get 3 responses. One is, what's that? Where is that? And what do you do? So we explain and, you know, carry on like that. That's the least asked question. The second response. And the second response that is forthwith is, I know STAR. I have a family member who goes to STAR. I'm familiar with their services. They help my sister, they help my brother, they help my son. So that's the second. And the third response I get, unfortunately, is, oh, you deal with them. So it's really a difficult response to hear, but it's the perfect opportunity to teach. So oftentimes I will talk about the treatment of STAR for our patients is just like as Dr. Bailey talked about, treating a patient with diabetes. When they come into our services, they are there because they have a medical issue. And if somebody is being treated with medication-assisted treatment therapies, it just means that they can be there for 2 months, they could be there for 2 years, or some of my clients have been there longer than I have. And that's okay, but they're in the right place, they're getting the treatment that they need, and they do get better. And they do go on and carry on with their lives, and they're very productive. If they are carrying themselves in society, we don't have to, and that is the ultimate goal. People being independent and working hard. So the third response, even though it's the most response that I do get, is the time that I get to teach and let people know that you may not realize it, but those folks are all around us all the time. They are working in the banks, they're working as pharmaceutical representatives, they're working in the pharmacy as a pharmacy tech, they're working as healthcare professionals, policemen, firemen, you name it. So it's not what folks think sometimes of people who are having problems with addiction. It goes right across the board. So I'm grateful that I work at STAR. I've learned a lot. My patients mostly have taught me everything that I need to know to be an effective caregiver in this setting, and the support of all of our ancillary staff, our counselors, our medical assistants, our administrative assistants, our physicians especially, have been fantastic in teaching even us as staffers to be more open-minded and to get more treatment into the city as quickly as possible, because we have a lot of fellow citizens who are dying. So we need to keep getting the word out there. I'd like to introduce Mike. He's one of our patients at STAR, doing great for a long time and really works hard in his recovery. So,
good afternoon. My name is Mike Kudo, and I've been an addictive individual since I was about 18 years old. My first time in Star was 17, and it's been a long road. I'm 53 now, and I've been through hell. I can tell you what hell is, but I can only say that if it wasn't for Star and the people in Star, I would be gone. I would be dead. And that's what's happening out there now. It's happening to our kids. You know, I have a young son, and thank God through what he's seen me go through in my life, he's learned, you know, to stay away from drugs, to be a better person, to hold the door for a lady. These things that are gone today why are they gone? Why are the simple things gone? It takes a lot of work. It takes a lot of work to be in a tight room like this because I have a problem with it. But I'm pushing through. And that's what you have to do with drugs. You have to push through. You have to fight. You cannot give up on this program. I cannot give up. If I give up, then I'm done. You know? Dr. Bailey and Lorraine, Dr. Bailey is my doctor. Lorraine is my nurse. And just all the staff at Star are unbelievable. You know, they saved my life. They saved my life. Every day in my head I think of Star and how much they've done for me. And I was really glad to hear from the mayor that how much that him and the committee and whoever's involved in this, the senator, that they're, you know, coming in on this and they're all in. I was really happy to hear that because I really didn't know what the situation was. But I'd just like to say that I've been on Star 7 years, and I had to restructure my whole way of thinking, like Dr. Bailey said. It's all restructuring. At a young age, I learned. I started smoking pot probably at, I think I was in 4th grade. All right, and there was some kids there who smoked pot. And then it progressed through there. And in the older days, in my younger days, it was mescalines, teas, paper acid, Percodan, you know? And I never got it out of my mother's cabinet. I got it from the street. You know, I was hanging in areas where, you know, it was tough. You know, I was hanging in Watsburg Heights. I don't know if anybody knows what that is. They knocked it down. But when I was young, before I went into the service, I hung out there. And I got, you know, I'm not blaming on it. You know, we all go through what we have to go through, and it's a choice. And I just feel that you could do so much more for the kids. You know, when you get my age now, I just think it looks, I just think that when I'm 53 now, I just been on the streets a long time. I've seen some bad things, but I know I can help kids. I know, I used to go into schools. When I was younger, I was in St. Mary's. And St. Mary's was a place when I was young, I was in Dartmouth House of Correction, and I went to St. Mary's. St. Mary's is gone now. It's in New Bedford. And I stood 8 months at St. Mary's. It was like a halfway house environment. And I did very well after leaving St. Mary's. I stood clean for 4 years after that. I did very well there. And what I'm saying is, we need education. And the stigma back in my day was terrible. When you were in the paper and your family came home, they seemed busted for heroin or for, you know, any other drug. You know, the stigma back then was awful. You know, the people in the neighborhood. I go to doctors, the nurses wouldn't want it. They'd leave me in the rooms. You know, they just didn't care back then. You have to care. You know, we're individuals. It's not just about, it's about our children. It's about the kids. The kids really need the help. And I'm asking, you know, the senator and the mayor, I can't believe what these guys are doing. You floored me. I mean, you can't say enough about Dr. Bailey and the nurses at Star, and the staff is unbelievable. I mean, they go out of their way. These nurses, and Dr. Bailey especially, they sit there and they listen to me. They don't have to because they're there just to give me medication and talk, but they'll take the time to talk to me because I'm wound up, you know? And I've been going to Star, I think my first time in Star was 17. And I remember my dad walking me in there. My dad's passed away now. And my dad was tough. He was a textile worker. My mom worked in a factory, and they worked very hard. And my dad walked me in that day, and he cried. He cried. So me being here today, I was telling Dr. Bailey, you know, there's got to be a purpose for me. You know, there's something, a quest here, or something I can do more for the kids. It's about our kids. You know, I just feel so strongly about this. And I don't want to babble on here, but I can teach so much. I went into the schools before. I talked to kids, and I had kids come up to me at the Dartmouth school. I had kids in 5th, 6th grade coming up to me crying because their parents, my mother was an alcoholic, my dad's doing this, you know, there's so many ways we can reach these kids. If they would walk up to me crying and ask for help, what does that tell you? I must have done something right to get to them, right? I know something, right? I got my GED. I went to Knights, got my GED. I was in the Guard for 7.5 years, honorably discharged. There's a lot of good things. Addicts do good things. There is, but you don't hear about it. You hear the bad, the negative. This one shot this one did this for drugs. Yeah, we do bad things. That's what we do. That's why we need Dr. Bailey and Lorraine and all the nurses and all the staff at Star. We really do. You know, they don't get paid enough, and they don't get enough gratitude, and I thank them today. I thank these both. All right? All right, thank you very much.
Thank you again to the mayor and the elected officials for showing up. Thanks for listening about the medication-assisted treatment options that we have throughout the community, definitely within STAR and our healthcare system here, but also at other agencies in the community. And if you leave here with one thing today, please join us as we work really hard to reduce stigma around medication-assisted treatment, any type of treatment for substance abuse, because it's a chronic medical condition and there is evidence-based treatment for it. The more we can view it as a chronic condition and treatment for that, I think the more the stigma will go down. So thank you for joining us today.